small variations, and there's general groups to it. And that's an important piece. Now, the azygous vein is a little more tricky. It's represented by the two tiny, almost railroad track things on the edges. And the azygous vein sits right in front of the spinal column, so in front of the bones. All right? As such, it's a very hard, virtually impossible place to look at with Doppler or ultrasound. The others, you know, the jugular veins, and even now the newer Dopplers, the so-called transcranial or veins inside the brain and head, inside the skull box, are readily assessed by ultrasound. The azygous vein is almost impossible to assess unless you put dye into it. You've all heard of the concept of injecting dye, taking an X-ray, and seeing what happens, which is exactly how they started doing coronary assessment years and years and years ago. All right? So that's an important differentiation in the two, and it is possible now in some centers to infer, by looking at the transcranial veins, to infer what's happening in the azygous vein. But classically, to see if there's any issue, you need to look at the dye. So I think that's a summary. Anything? Yeah. So I think that will give you a baseline of what's happening, because some of you have had a chance to see the pictures and others haven't. But now, hopefully, we're all in the... And I'm also very keen to hear the rest of our presenters, so I look forward to that.
Thank you very much. And Dr. Code has agreed that if at the end of the session when we do question and answer, if there is a question that one of the panelists can't answer, he has agreed to be our medical person on the spot, and so we're really appreciative of him staying around for that as well. We're going to go down the table now, and please, we're going to start with India and then move through Poland to Mexico and finish off in the United States. So we're doing a little bit of around the world here as we go through the panelists and where we've been treated. I would ask that you save your questions for the individual panelists until the end, and we're going to try to save as much time to the end as possible. So if you have a question for an individual panelist, write it on the palm of your hand or in a scrapbook, and then when we open up for Q&As, we'll be wandering with the mics, and you can ask your question to the panelists that you wish to, or just throw it open in general and say, did any of you ever hear your doctor say X? And so with that, I'm going to introduce our first panelist. It's Sylvia. I'm not going to try her last name. And Sylvia is here to tell us about her treatment experiences in India. So take it away, Sylvia.
Okay. My name is Silvia Runategi, and then after I got so tired of MS and I was sitting and sleeping all day long in my bed, I said, there is something wrong with me. So I said, okay, I started to investigate, and I said, well, I will go to Italy. No, a long waiting list there, 2 years. And then I said, no, I will go to Poland. A long waiting list again, 1 year. And finally I found India. And then I said, can I talk to the doctor? And the doctor said, yes, I am. I said, okay, do you speak English? And he said, yes, I speak English. Okay, I am in Frankfurt, so I will arrive there. Amazing. Then he said, okay, Sylvia, if you come, I will operate you. I said, okay, where did you get your degree? He said, in Johns Hopkins. I said, well, okay, you will get my operation. Then I show up in India, and I was able to see him. And then, of course, I met a lot of people. But at the same time, I used a person, her name is Jasmine, and she was excellent. She programmed everything for me, and I was in the best hotel that you can imagine. So one day I said, what a nice weather, so I will go out, and went out because it was sunny. And then I started to sweat, and I said, how hot is this? No, we're only 53. I said, 53? Yeah, we always make it to 58. I said, forget it. So I went in again to my hotel, and I said, this is crazy. And then I talked to Jasmine, that is the person that planned everything for me. So I said, this is awful. I cannot even go out to eat. Then she said, go to the floor 18. So I went to the floor 18 and I said, here I am. I come from Canada and I am starving. And they said, okay, do you want to have breakfast? I said, yeah, whatever. And then she said, okay. And then the waiter came with a big lobster. I said, oh, this is free? Yeah, that was free. I said, okay, I will come back tomorrow. And then I started to go every day. And then one day she said, Sylvia, you don't want to eat Indian food? I said, no, too much curry. She said, no, I will prepare for you Canadian food. I said, okay, perfect. And then after that, of course, I went through the doctor, and the doctor started to do a lot of tests, MRI, X-rays, everything, until 2 days. And then after 2 days, he said, you are ready for the surgery. I said, what kind of surgery will I have? He said, well, I don't know, Sylvia. So I went to the surgery, and I said, okay. So they put something here, and they went all the way to my heart, no problem. Then they went to my neck, and then 2 red lights. And I said, what is that? Am I dying? They said, no, you have a blockage in your vein. I said, really? Yeah, and you have another blockage in the next vein. I said, really? And then he said, we can dilate it for you. I said, okay, disappear that. And then he said, okay. And then I said, ooh, it's really painful. He said, no, Sylvia, you are feeling because we are disappearing the blockage. I said, okay. So I said, how long is this surgery lasting? He said 2 hours and a half. I said, but you told me it was going to be only 1 hour. He said, Sylvia, we didn't know what kind of blockage you have. Okay. And then he said, okay, we clean your 2 veins. I said, well, wonderful. And then he said, Sylvia, after this, we want you to come 4 times. And then they send me every day a taxi from the hospital to check me and to check me and to check me. And I was improving and improving and improving. It was amazing. So I said, every day was better and better and better. When I was not even able to walk or to do anything, I was able to talk and to do everything. So it was amazing, really, it was amazing. And then the doctor said to me, Sylvia, after 3 months you will improve. The 3 months are not over because I have this in June the 10th, sorry. So the 3 months will be in September the 10th. So I'm hoping that I will recover. But anything that I want to tell you guys, if you want to go to India, please go. Because it was just like a honeymoon, excellent hotel, and excellent doctors, and excellent everything. The only thing is they all believe that they speak English, but you don't understand any of them. It was terrible. It was terrible. But it was a very nice experience. And then when I came back from India, the first day that I said I will have the surgery, I stopped injecting myself betaseron, that I've been injecting myself for 15 years. And I left it cold turkey. So I said to my neurologist, that is Stanley Hashimoto in Vancouver, he said, Sylvia, nobody leaves it cold turkey. I said, nobody, but you don't know me. So I left it cold turkey, and I am very well. It's amazing, very, very well.
Thank you, Sylvia. And our next presenter is Betty Notar. And Betty has some PowerPoints. And are you just going to signal Landon when you want to change the slides there, Betty?
Sure, that sounds
Okay.
great. So I'm going to talk to you about my experience in Katowice, Poland, 4 weeks ago. And for those of you who know me personally, know that I tend to be quite a private person. So for me to talk publicly, especially about my health, is a bit of departure. But it was so helpful for me to talk to real people who had gone through the experience in my decision-making process that I am more than happy to share my experience. So, slide, thanks. So first of all, I was diagnosed with MS in 2004. I've been treated as if it's secondary progressive. Sort of minor symptoms that started to worsen in the last couple of years, primarily fatigue, drop foot in my left leg, some mobility challenges. Have not taken any of the MS medication. Have followed basically a more holistic, complementary approach, paid attention to my diet, tried to do lots of yoga, nutritional supplements, regular massage, that kind of thing. So when I heard about CCSVI, very interested, did lots of research, like I'm sure many of you have here, and decided not to go to False Creek to get sort of private testing. First of all, it was $2,500, and that test would not be applied to any treatment here in Canada. And it was a 6-month waiting list. And I figured if I'm going to go for treatment, they're going to want to redo the tests anyway. So I thought I'm not going to do that. The neurologist I see is the head of the MS clinic at the UBC hospital. She said, don't waste your money, it's all a fad, and didn't offer me anything else. So I thought, well, my GP was supportive and said to me, if I was in your shoes, I would do the same thing you're doing. So that felt very supportive. So I checked out a whole range of clinics, put money down in Scotland, checked out Poland, couldn't get calls returned from Albany. But the Poland Eurometa Clinic, I gave them my name on March 23rd, so I was on their waiting list, and was impressed with their research that they do. They trained and studied closely with Dr. Zamboni, followed protocols according to Stanford, and I'd heard about them on CBC, watched the two brothers from Winnipeg, talked to Ginger McQueen from Calgary who went, so I had sort of a bit of a contact with them. So anyways, on June 1st, this is the clinic of Katowice. It's basically Soviet-style architecture. It's pretty bleak. It's a clinic that is rented by a private group. There's a very well-trained group of physicians, cardiologists, vascular surgeons, a neurologist on their team, a whole range of internal medical specialists. So I was impressed with their team. So on June 1st, next slide please, I got an email. My first response in March told me it'll be sometime in 2011, so, long waiting list. But June 1st of this year, I got an email from Katowice saying, are you still interested? It's going to cost 6,900 euros, it's about 9,000 Canadian, and it's going to happen sometime in July or August, so just a heads up. So 3 days later, I got another email saying it's confirmed, it's July 12th, and please confirm with us within 3 weeks and send us a full amount of the money. So I, again, scrambled around and talked to some other people that had gone and decided to take the leap. You do get reimbursement if you don't have, I didn't get stints at the end of the day, so I will get 500 euros or $700 reimbursed. And if you end up going over there and they find no blockages, you get about 75% of your money back. So off we went to Poland, my partner Nance and I. At the end of the day, this is expensive. The treatment was the equivalent of 9,000 Canadian. Airfares in peak season of summer, and we decided to go a little early to get over jet lag and stay later in beautiful Krakow. So altogether, I figured it's about 17,000 Canadian that we've spent, which I intend to claim as a medical expense on my federal income tax next year, since this procedure is not available in Canada. So July 12th, I have some notes here so I can follow along so I don't have to look. July 12th was the big day. There were 6 of us. They do 6 people a day, 6 days a week. 70% of their patients come from Canada, I found out. The rest come from Europe. In my group of 6, you bond pretty intimately with folks. There were 2 other Canadians, 2 from Great Britain, and a young lieutenant from the Dutch Army who was there. It was quite a trip. So July 12th, we had an eye exam to see what kind of inflammation was going on. That's for their research purposes. Then we had an MRI of neck and blood vessels following their Stanford protocol. A couple of people in my group had had prior testing. They'd paid for it privately. They'd had false negatives, so they had been tested elsewhere and told no blockages, and they showed up in Poland and went through all their diagnostic